eventually none of it bears fruit, and your team is sick and tired of you constantly asking them to try new solutions. So it has to be an integral part of not just the annual operating plan, but the strategic plan for the next 3 to 5 years. So that also means that as administrators or as IT experts, we need to be aware of what are the existing gaps, what are the projected gaps, what are the future growth plans, and what is the direction the market is going to take. Yeah. You have to match both of them. So that is one way of avoiding silos. And it's also important to include all the stakeholders in the discussions. Doctors and nurses have to be part of this discussion wherein we are evaluating the digital plan for the next 3 to 5 years. Often when we're looking at digital solutions, the digital solutions that we're trying to adopt often address non-clinical or operational issues and gaps, and clinical outcomes are not really addressed by most of the digital transformation projects that most hospitals take up. Very few hospitals that are exceptions to this. So we should give due weightage to solutions that address clinical problems. So if there is a solution that can, let's say, reduce the risk of patient fall, reduce the risk of HAIs, reduce readmission rates, address burnout rates among nurses and doctors, I think such solutions will have more stakeholders easily adopting it rather than resisting.
That's a great explanation on that. So interoperability between man and machine, or in between machines and platforms, and how to integrate for the betterment of healthcare is what we wanted to ask for. So with that, I would ask Dr. Natesh Bala the next question. How do we address the concerns of clinicians who feel digital systems add complexity rather than ease their work?
That's a great question, Tusai. That's really the question actually. There's no point in having a big digital system, however good it is, if people are not going to use it, especially the clinicians, right? So I follow a very simple approach. I don't tell them that this is my EMR, if you're getting a new one, start using it. No, that they will never listen to it and they will be resistant. I rather tell them, do you want a better way to cut down your work timings, right? So I tell them that what you're now doing is taking you 45 minutes. By using this system, you're going to finish it in 15 minutes. Now that I find really works because doctors are always keen to save time, right? Either if it's for more cases or for getting home early. So I think you need to involve the clinicians, like Dr. Stephen was saying. I think we need to have a very, very collaborative approach to the whole digital transformation at whatever level you're trying to do. And especially clinicians, I don't think they no longer resist. They just find it, unless you tell them that it's really important, they don't want to get into it. And the best way to do that is to tell them that by using this, you're going to save time for both yourself and the hospital. I think an approach like that works better than getting something and then trusting them into it.
So that clears the answer for our question. Today, in the era of artificial intelligence, tomorrow it's going to be hypersonic intelligence is what they say. It is going to be even more advanced, and as medical professionals, we need to integrate that into our system before we get outdated. But there are old clinicians who do not accept the fact that the computer era is entering into our system and they are now not able to go. But as the age goes on, definitely integration will be the next line of treatment in our system. With that, I have our next question to Mr. Vijay Roy. What change management strategies are critical for ensuring hospital staff adopt digital tools effectively?
One thing is, for any technology we are coming out or we are just trying to enforce, will never be successful. So the technology should be very simple, ease to operate and understandable. Because in the healthcare we see that there are lots of manual works and documentations are happening, and changing that complete into system digitalization is not very easy. Making them all the employees to understand it is a continuous kind of training process. Then it is kind of understanding them to take it as an ownership basis. so that every employee should take that process themselves as the owner of that. And then one is regular follow-up and monitoring, and along with that, definitely a recognition and award, which is very important, so that we give encouragement to others to see and complete the whatever the project or process we want to set for. So these are the things where we need to look at, because any technology should not drive human beings. Human beings should be driving the technology. If in that sense, if we come up with the solutions, with the programs or whatever initiatives we want to take in the digitalization, it must be very understandable, very easy way to operate. If you see nowadays we are using so many apps, even in the mobile, either Swiggy or we go for any airlines booking, in 2 or 3 clicks we are completing the whole things. So everybody wants to be so easy that we don't have to do it again and again, filling of the details, go there, save it, download, attach. So that all process leads to somewhere very difficult thinking of anybody else who is working for in this industry for a long, and suddenly they have to switch to the digitalization. So it will not be very easy. So we have to see that for whom we are going to make this digitalizations, the process should be according to them. So it should be so easy that it can be easily adaptable to them. One example is I give in the supply chain management in the hospitals. We all know that there are supplies comes from different vendors. Then we go for a GRN process, goods received not in the stores. And then you take the product or supplies in your system in, so that in the IPD or OPD it gets consumed and it is consumed out. So that is the main process. So all these process, if you see, the getting the supplies and making GRN is a very long and tedious process. So a person of a store or pharmacy will be killing at least 1.5 hours, 2 hours each GRN to process. So because there will be lots of many items, you have to see the expiry, batch number, and all those things. So digitalization, how it helps is our IT, we have developed a platform on what is called is optical character recognition, that is OCR platform. So what happens the moment the vendor is generating the invoice, we have given them a login ID with our software HMS. So he put it this invoice there itself. Once he is ready to dispatch as per your purchase order. So what happens the moment the goods received, you are ready to go for GRN, because that way the vendor will put all the details regarding your the conversion factor, pack size, everything correctly. So here there will be no error, and it will be a very time consuming. In a click you can go and GRN and done and process. So these are like things. So what happens is when we bringing this into the system, there are lots of issue with the team, understanding and all. Once they realize, once they started working on it, they realize that it is a very easy and it's a time saving. So for which they used to take it so much of full day time for making the GRN, they are doing in a click. So once they realize how the process helped them to move and to come out with the tag for their departments, that has become very acceptability with the whole outlet from the all. But that is the way. The solution should be from the point of view of the users, how they want, not rather than what we want.
That's true, but what we wanted to emphasize also was increase in training, smart solutions for training. Like how the difference, what happened to Nokia and what happened to Samsung today. Because they didn't update themselves, they didn't find innovative approaches to penetrate the market. The same applies for healthcare too. If you are not educating your staff smartly, definitely they are not going to catch up, and they are going to take you back to the stone ages where you're going to write prescriptions and then you're not going to enter into the digital age. So pumping up with more and more infrastructure and training definitely matters, where Kaveri is doing a sizable amount of training. With that, I would like to move to our next question to Mr. Raghav Rao, that what role does sustainability play when rethinking hospitals in the digital era?
Yeah, sustainability, I think, is a topic that is on top of everyone's mind who is planning hospitals or operating hospitals. And I think it is no longer an option, but I think it is mandatory to absorb sustainability into everything that hospitals do. Recently, we've been looking at some statistics on. See, everyone feels that if you have to incorporate sustainable measures or sustainable material into hospitals, it's going to be it's going to involve high operations costs and high capital expenditure. But that's actually wrong. The data shows that whichever entities that have incorporated sustainability into their operations and into their capital, into their project costs, they are actually the most profitable. So in the long run, sustainable interventions and sustainable measures actually are leading to improved financial performance. So that's one myth that has been busted. That it actually is helping the hospitals financially. Second, I think many of the sustainable measures, sustainable interventions like bringing in natural light, enabling fresh air, are actually leading to improved clinical outcomes. So therefore, from a hospital's perspective, I think it is not an option anymore, but it's mandatory. Is what I can say. And there are a lot of ways in which sustainability can be incorporated into hospitals. From as simple an intervention as enabling natural light into patient areas and other parts of the hospital, which enables healing in a much faster manner, to using systems like solar and others, which are also being promoted by the government, will lead to significant cost saving and a much more efficient way of operating a hospital. So, and what this involves is, we need to have the sustainability thinking right at the beginning of planning a hospital. Then it makes it much more easier. We have some, very good big names in architecture out here, Siddharth is out here. So they all involved with a lot of planning of sustainable, interventions. So I'm sure you can connect with what I'm trying to say, but it best works when they're incorporated right at the beginning. Of course, it's not impossible to bring them in at an operation stage, but I think the amount of work that requires